The test item cluster for mechanical neck pain that will benefit from thoracic spine mobilization has 6 features to it. The first being acute onset, so less than 30 days. No symptoms distal to the shoulder. Looking up doesn't aggravate the symptoms. The ceiling. The FABQ score is less than 12 out of 24. They have a diminished T-spine kyphosis, so a flattened spine. And the cervical extension range of motion is less than 30. Could you lean your head back for me? Okay. I'm going to be completing the test item clusters for a full thickness rotator cuff tear and subacromial impingement. For a full thickness rotator cuff tear, we'll be doing the infraspinatus test, painful arc test, and drop arm test. If you could put that right arm at your side, please. We'll do the infraspinatus test. Resist me pulling you in. Good. Now painful arc, let's have you raise that arm up to your ear. Let me know if you feel any pain and if the pain goes away. Good. Now finally the drop arm test. Let me take your arm out to 90. I'm going to let go. Lower your arm slowly to the table, please. Good. A positive test would be him not able to control that movement. For subacromial impingement, we will again do the infraspinatus test and painful arc test. The only difference is we're going to complete the Hawkins-Kennedy instead of the drop arm. So I'm going to flex his arm and elbow to 90 and internally rotate. A positive test would be pain or clicking with that motion. Test item cluster for patients with mechanical neck pain that will benefit from cervical manipulation are symptoms lasting less than 38 days, the expectation that they will benefit from manipulation, pain on PA glides in the mid-cervical spine, and cervical rotation range of motion difference of 10 degrees or more. Okay, can you turn to the right for me? Good, back to the middle, and to the left. Okay, good. The test item cluster for cervical radiculopathy includes having less than 60 degrees of ipsilateral cervical rotation, Sperling's test, distraction test, and a positive upper limb tension test A, which is a median nerve bias. We're going to test your rotation. So can you turn to the right for me, please? Good. Back to the center. We'll do Sperling's test. So I need to have this ear touch your shoulder, please. Okay. And I'm going to put a compressive force straight down. Okay. Any symptoms with that?
No.
Okay. Let's have you lay down with your head on this pillow. Okay. Are you all right there?
Yeah.
Okay. I'm going to place my hand behind your head and on your chin and place a distraction force. Is that all right? Okay, we'll hold this as long as we can, but for now we'll let go. We're going to do the upper limb tension test for the median nerve bias. So can you see a little bit closer to me, please? Good. I'm going to depress your shoulder with my hip. We're going to extend your wrist and your fingers, and then extend your elbow. Any symptoms there?
No.
Okay. Good work. We're doing an upper limb tension test for a radial nerve bias. So I'm going to borrow this arm. I'm going to depress your shoulder. We're going to flex your wrist and fingers, pronate your arm, and extend the elbow. Any symptoms with that?
No.
Okay. I'm going to go over a couple differential diagnoses for a C5-6 radiculopathy, rotator cuff tear, and impingement. For the C5-6 radiculopathy, we may see sensation deficits and the C5 and C6 dermatomes, as well as diminished reflexes of the biceps and brachioradialis muscles. We may see weakness in the C5 and C6 myotomes, C5 being shoulder abduction, and C6 being elbow flexion, wrist extension. If you could lie back, we'll do the distraction test. With a C5-6 radiculopathy, the patient should have a positive distraction test, which would be a reduction of symptoms as I apply this distraction force to their neck. Okay, if you could go ahead and sit up for me, right to the edge of the bed where we came from. Good, now we'll go over rotator cuff tear. We would test the infraspinatus and the painful arc again, but we'd also do drop arm. The only difference with drop arm is for a full thickness rotator cuff tear, a positive test would look like this. But for partial thickness it may catch and be taken over by the deltoid, so he may be able to lower his arm to the table successfully. For impingement, we would also complete the infraspinatus and Hawkins-Kennedy test that we've done previously. But for the painful arc, to determine where the impingement's occurring, if the impingement happens between 60 and 120 degrees of adduction, it could be subacromial impingement. But if the impingement happens in the last 10 to 20 degrees of adduction, it could point to AC joint impingement. I'm going to perform the jerk test. So this is for a posterior inferior labral tear. I'm going to stabilize the patient's scapula and then abduct the arm and elbow to 90. I'm going to apply a posterior resistance force while I internally rotate and adduct the shoulder. Any pain or clicking with this motion is a positive test. I'm going to be completing the active compression test of O'Brien. This is used to detect a slap lesion or a superior labral tear. So we're going to flex the patient's arm to 90 and internally rotate so his thumb is pointing to the ground, and then horizontally adduct 10 to 15 degrees. Now, resist my downward force. Good. Now, if this motion was painful, we would then externally rotate and supinate the forearm. Now, resist my downward force again. Good. Now, if this was painless, then the O'Brien's test is positive. We're going to perform Phelan's test. This is for carpal tunnel syndrome. I'm going to have you put the backs of your hands together and press them firmly. Good. Now, if he experiences tingling in his thumb, pointer finger, middle finger, and half of his ring finger, which is the median nerve distribution, after 30 seconds to a minute, then he has a positive Phelan's test. I'll be doing the Sharp's Purser test. This is testing the stability of the alar ligament, which is very important after motor vehicle accidents or any accident that resulted in a whiplash. A positive test would be clunking as I'm moving C2 on the opposite foot.